Hello, everyone, and welcome. Sharon Weinstein and I have an amazing guest today. Her name is Lisa Hallam. And we want to give you some background a little bit about what you're going to hear about today. But first, I want to introduce Lisa. So, Lisa, welcome. And Sharon, thank you for joining as well.
A pleasure. I'm so excited to talk to a nurse's nurse.
Oh, thank you for having me.
I love that. Yes, you are a nurse's nurse. So, let's talk about you. So, Lisa, I don't even know if I can do justice, but I'm going to try. So, 32 years in nursing. She's been a pediatric nurse. She's been in the ER in Kansas City for 15 years. She was at Mercy in the ER in 2005. She's also chemo certified from St. Jude. And she's an RN that runs into the fire, as she says. And she's also been was PRN with Select, and then she kind of jumped forward, became the director of an ER there at Mercy here in Springfield, and now she is the interim CNO for Select Medical, the long-term acute care hospital here, specialty hospital here in well, I should say the region, because you got promoted. So I'm going to ask you, Lisa, did I get it right at all?
You did great. You did
And
great.
tell
Thank
us
you so
about the
much.
promotion. I love promotions.
Yes.
It was. Select is amazing at promoting within. And I had the support from my leadership team there to jump forward and take that leap of faith. So I went from a local CNO to now what's called an interim regional CNO. So I'll be able to travel to over 100 hospitals
Great.
to make sure we're all on model with our Select values and core procedures. So yeah.
Yes. And I love the work you do. And as I shared with you, Lisa, and you didn't know this, but my dad was recently in a select hospital, and I will tell you the care is unprecedented. And I can tell you, amazing people work for Select. So I want to say thank you from my heart. So thank you.
You're
Um,
most welcome.
we want to talk a little bit today, kind of what's broken and how we see the challenges. And, LTAC is not just a common word. A lot of people don't really understand where does this fit. So I'd like for you to explain a little bit about the long-term acute care facility. And I'd love for you to talk a little bit more about the challenges that you feel that, you may face in the healthcare of people that are in LTAC.
Absolutely. So, Select is a special breed type of hospital, being a critical illness recovery hospital or long-term acute care. Lots of different initials. But basically, what we're blessed to do is take care of the most medically complex patient that needs that little extra step. They can't go to rehab yet. They're not ready to go home and do self-care, and they aren't necessarily a skilled type patient. They don't need the nursing home setting. So we are able to give them that in between. Our average length of stay is about 26 days. We have very complex patients that are managed by multidisciplinary team approach, which is really the key. What I can say the best is our collaboration with our therapists, the rehab therapists, the respiratory therapists, our occupational speech. And then we have an amazing providers, so nurse practitioners and our physicians, our pulmonologists. We're able to really do extreme ventilator weaning. We're nationally above average. So those patients that just, of course, during COVID, we were extremely popular, but getting them off the ventilator so that they can get their strength to go on and live their new normal life. So I think we have miracles every day inside our buildings across the United States, and it's not something a lot of people know about.
Yeah.
So yeah, very lucky to be able to share in that work and be a small part of that journey for those patients.
That's really exciting because you are, in fact, the interim. You're closing the gap. You're bridging the gap, if you will, between the acute care setting and the long-term care setting with something that is, in fact, an absolutely excellent mix of both that gives the patient exactly what they need at this stage in the recovery process.
That's correct. And, when I interview nurses, we advertise a lot on Indeed. We go to job fairs. We go to a lot of different events, and they've never heard of this type of nursing before. A lot of them will say, oh, no, I don't want to go into a skilled, they call another word for it.
They don't want to sniff you.
No,
nope,
they don't want a sniff unit. I'm a nurse. I want to go treat medically complex patients. I said, I've got them. They're orally intubated. They have fresh trachs. We put peg tubes in our patients. Like, our patients need your skill and we need you. And so we grow our own. We're the only hospital system that has a CNA to RN full scholarship program. So we will 100% of your schooling. If you will join with us for a year commitment, we'll send you to school of your choice. So you get to pick your nursing program, and then you stay with us for 2 years, hopefully forever. But it's an amazing program. It's one of the only hospitals I've heard of in the United States doing this. A lot of LPN to RN or RN to the BSN, but I've never heard of a CNA program to the RN. So
no, nor have I. No, and I'm on the board of one of those schools of nursing you've heard of. So I totally get that. And when we obviously recommend RN to BSN or nurse completion programs, it's obviously using our university.
Correct.
Not a choice of universities.
We want it,
a place that works for you.
It's being flexible with the applicants. They're looking for that flexibility. So they want to be able to choose their program. So as long as it's an accredited program, we will meet them halfway and take care of full tuition for them.
That's amazing. Wow. That's truly amazing.
That's fabulous. Yeah. That is growing your own. That truly is growing your own.
It certainly is. And it is life-changing. If you could see the expression on their faces when they've learned that they won the scholarship, it's life-changing for them. Most of them are working moms. A lot of them are single working moms, and they never thought they'd be able to come up with tuition money.
You're growing your own pipeline, but look what you're doing in terms of transforming their lives.
Mm-hmm.
And hopefully it rolls over to our patient care. So what Select does right is they value their coworkers, and they, in turn, that what the care they give to their patients, it shows how much they love working for the company.
Mm-hmm.
So they've got that part down. If you value that coworker and treat them with dignity, they in turn will treat their patients with dignity. Because I tell everyone, you don't graduate from nursing school saying I want to be an LTAC nurse. That just doesn't happen. Most people don't even rotate through this type of hospital.
No, they've never heard of it.
Never heard of it. So that's the one thing I'm proud of. Yeah.
And that's so amazing. And I just love that. Speaking about that, because you're solving some of the critical things that, all healthcare systems need right now is recruitment. What do you see as the biggest challenge for retention in the LTAC space?
That's a great question, because I love recruiting. It's one of the things I'm most passionate about, is finding the right person for this organization. And COVID changed that for nursing. In the past, you didn't go into nursing for the pay. You certainly didn't. It wasn't one of the top jobs that you would go into. You went into nursing because you were called into it. A lot of personal reasons why people go into nursing. And it's something that fulfills you. So you feel almost like going to work is not work. It's a passion. And so
it's a calling.
It's a calling. But travel nursing and COVID changed that. When you start advertising positions I have a friend that was in New York, $10,000 a week that she was making. So that's money that a nurse never even dreamed of. And it slowly has gotten back to a pretty normal type of salary for nursing, but still there are travel companies out there paying top dollar for nursing. And so people, their loyalty to an organization, as soon as something shiny comes along, they jump and they want to go try it. And so that's the generation we're seeing now. So that's why we're trying to grow our own, promote from within, sustain a culture that shows that mutual respect, because the loyalty part of, being a nurse for 32 years and having 3 organizations you work for, that's like unheard of right now.
Right. When we go back to that healthy work environment, what do we need to do? What is the systems, and what does healthcare need to consider to create that healthy work environment? There's a lot of discussion. There's a lot of different articles out there around occupational therapy and the mental health, even for all of healthcare. I'd like for you to speak to that. what should people be looking to do to kind of bridge this gap that we have?
Or what's missing and what do we need to do differently?
Mm-hmm.
That's a great question. That's a big question, isn't it? The secret recipe.
Mm-hmm.
I talked a lot about valuing that coworker. You have to care about that coworker. I'm lucky enough to have worked for leaders that know every single coworker in their building. And when they ask them, how is your day and how are you doing? They really they care about the answer, and they pause and they listen. They don't walk on and say, I have to go to the next meeting. I can't talk to you about it right now. Or I'm rounding and this chair shouldn't be in the hallway. That's not what the coworker is looking for. They're looking for the fact that you as their leader, really, they do care about the response. They take the time to listen. And, with that, knowing what healthcare has gone through with the pandemic, I mean, self-care is so important for your teams right now. So making sure they're not working as the overtime, making sure you have your positions filled, making sure their vacation is granted, making sure they have flexibility when they need it with their families. When I hire people, I tell them, I lead, and I do this, and I tell them in the interview, it's faith, family, and then work. And whatever your faith looks like, I will support that. I need you to be strong for your family, so when you come into work, you can give back to your work. So however I can help you navigate through faith, family, and work, I'll help you get there. So
I love that. That's so
Faith,
powerful.
family, work. I love it.
So powerful. So how do you inspire people once they're hired to stay in that mindset?
Well, Select does give you a very, structured format. Reach that coworker day 7. Make sure you're making that intentional touch point with them as the leader. Make sure you take them to lunch, bring them a coffee, listen to how they're feeling after that first 7 days on the floor, because that's when they're starting to really, they've had their classroom orientation. Then we give them 2 weeks out on the floor. So we don't want to lose anyone, obviously, after they've started, but that first 30 days is so important. Stay engaged with a coworker. We give them an advocate. So someone besides me, it might be the materials manager, will stop and ask them, how are you doing? And ask them intentional questions. Has there anything that's been frustrating? Are you able to log on to see all your benefits? Do you have a direct line if you need to call in? Like all those questions that a new coworker might be anxious about, we try and alleviate right at the very beginning of those first 30 days.
So it's a live onboarding process, not just something that they're going to access online and hope that they're getting it right and making the right clicks.
Right.
They actually have someone on their side who is advocating for them. I love that. And I also love what you said, asking intentional questions. Chances are your people are also listening with intention, which is what matters most. People know when they're being heard, don't they?
Absolutely. And if I do have someone that I feel they've answered something where, I'm not sure this is going to go the right direction, I will follow up with them immediately and say, what you said to me, I really took that to heart. And I think we can help you through this. And here's my suggestion. How do you feel about that? Can I meet you halfway? Or do you have another suggestion that we might get over that hurdle together? So those are the things that I think just they want to be heard. That, most people, when they take a new job, it's that first 90-day probationary period, and Select almost looks at it on a week to week. So not only are they meeting our needs, but are we meeting their needs as leaders?
Right.
Like I ask them questions like, what more can I do for you this week so you feel supported? And they'll answer. That is the thing about this generation. Don't ask the question if you don't want to know the answer. Because they
Exactly. They will tell you. What would you say your average length of stay for staff is with Select? Do you have long-term people who have been there for years and years, or maybe they've left and they keep coming back for more?
So that's a great question. I'm in Mississippi right now in Gulfport. I've been here for 3 weeks. And we just celebrated 3 coworkers that have had over 20 years.
Wow.
Of service here. And that's about as long as Select has been open. So really great longevity. Now, every hospital measures their turnover. So I know we watch it very, very closely. And then the biggest turnover can be in the NA position, the CNA position, because it is sometimes a stepping stone to a bigger promotion. But at the same time, it is very important. They don't have any agency here right now. So they're all core team staff. That didn't just happen overnight. That was intentional. They hired 40% of their agency nurses converted to full-time Select coworker here.
That's huge.
40%.
That's huge.
Wow. That's incredible.
And I can't take credit for that because I've only been here 3 weeks. So this is a team that was struggling because a lot of their nurses left to go travel. And so some did come back, but the others that did come back, they hired their travel nurses to stay with them.
Wow.
Okay, now I have a question that begs an answer, right? There is something that triggered for those 40% that were hired that said, I want to do this and I want to stay.
I want to be here.
What was the magic sauce?
Mm-hmm.
Well, I don't think very many of them knew what LTEC was. So they just got sent here on a contract. And then when they saw it, they said, oh my gosh, I can use my ICU skills. I have my patients longer than, 24 hours, right? I'm not constantly admitting and discharging like on a med surg unit.
I can use all of my critical thinking skills. I've got this.
And I think that the leadership here, they have a very strong leadership team that they've empowered their frontline coworkers to welcome the team. They are part of us. We can't do this without them. So these agency nurses felt very welcome, and they had other contracts at other facilities and said they never felt that welcoming experience.
No, they never wanted to stay there, for sure.
Now, I did steal something from the Select in Springfield that I love. Whenever a patient comes to their unit to admit, they page overhead, I'd like to give a warm welcome to room 365.
Yes.
And that the paramedics that are bringing the patient on the stretcher and the patients themselves, they already felt the welcoming feeling. Mm-hmm. Most hospitals, when you go there, you'll hear lift help needed in room 365. And so that makes the patient also feel, oh, I'm so big, I need help getting over to the bed, or, it's just not a very welcoming experience. Mm-hmm. So I always say words are powerful, right? Words are so powerful. So 3 weeks ago, I asked the team here to try using the warm welcome when a patient arrived. It has taken off so beautifully. Even the paramedics have said, wow, we really like coming here. Like, you all are so welcoming to us and you listen to us when we bring our patients. So simple, powerful words.
It's like working with toddlers when you say use your words. The difference is you're saying use your words in healthcare, in this space in which we work.
Yep. Something else they did, which was super impressive to me, was that the whole team of people came in to introduce themselves to us and said, this is who this is, this is who this is, this is who this is, it's pharmacy, it's case manager, it's your nurse, it's your physical therapist, it's the team of people. And it was just like, it was like the Babemba tribe coming in to give, some affirmations for being here and thanking them, so it was very impressive. It was very kind of wow, because you felt like you can go to somebody and ask a question. They will stop, they will answer your question. So, I want to say kudos to you too, because that was super impressive for me, being, my father's caregiver. So I love
that. Yeah, those are care conferences.
Yes,
that is
I couldn't remember what it was.
Intentionally set to where we even give you a piece of paper that has every leader's name on it with our cell number. So you can use it at any time. We make that very apparent.
Yep.
And I don't know very many organizations that do that. You have you have availability to the CEO of the hospital anytime you need it. Yeah.
Otherwise, you get that white chalkboard on the wall, that marker board, with the name of the person who's responsible for that shift and their number that they may or may not answer.
No, that's right. And when I call a physician, it was hello, oh yes, Dina, let's talk about this, right? So it was quite different compared to the other place where he is right now. From a step down perspective, it's a very different experience. So I really appreciate that. I want to go back to something that you said. There was a word you used, which I think is really powerful. Sharon and I talked about it early this morning, Intentionality,
Yeah.
and what a game changer that is, right?
Mhm.
Mm-hmm.
So when you create intentionality, talk a little bit about, because you go from one hospital to the next, or you're going to be shared amongst different organizations. How important is intentionality in the culture?
It's probably one of the most important things. I mean, I'm a guest when I go into their hospital. I'm a guest. I want to make sure that they know that I value the structure they put into place, but I intentionally have to do my role, which is to get them on model so we can have, or make sure they're on model so they can have the best care, because it's all about the patient. The patient's always in the center of everything we do at Select. And so if we all are doing the same thing with intentionality, then we're going to have good results. We're going to have the end results that we want as an organization. And so we believe it. And if you believe it, and I've seen it happen, I've seen struggling hospitals then reach amazing quality metrics, which is how we measure our success, is by the quality of care we can give to our patients. I've seen hospitals that have struggled quarter after quarter, and then when they get on track with doing intentional care, intentional processes, and explaining the why behind it, they're then at the top. And it's such a beautiful thing to watch a team celebrate that. That's the part I love most about being an interim, is helping a hospital that's struggling. I get teased a lot when I did decide to take this leap of faith and take another role. They said, "But you love where you are. You love what you're doing. You're so happy there. We can tell." And I said, "I am, but I do think that we are called then to be intentional with other hospitals in the same organization. I never would have left Select, but they had this role. It was almost perfect for me. But it was time to be uncomfortable. It was time to be uncomfortable to help the organization as a whole. And I just hope I can do that where I'm sent."
I love
If
that.
the smile on your face and the gleam in your eyes is any proof whatsoever of you finding your space and being where you are, you're in the right place.
Well, thank you.
Yes, I totally agree. So, I want to end on one question. I'm going to hand it back to you, Sharon, if you have any other questions. But I'd love to get some ideas for people in healthcare who find that period or that day when you're short-staffed because everybody's working short a lot of places.
Mhm.
How do you create this intentional resiliency that is called upon for that day? How do you create that?
Well, I can give a real life example of that. It just happened here. The flu has kind of hit this department. So we were struggling and needing some more CNA help last night. And the crew came together and we were able to put an extra nurse on the schedule. So we made smaller teams so our nurses could give one-to-one care, do some of the NA work, which is the vital signs that the NAs take care of, the bathing, the turning. And so my nurses felt supported. The NAs felt very supported, and they were so grateful. So this morning when I came in to check on them, they had a wonderful evening, and I was worried about them, but they are resilient. I mean, if there's one word I can say about this team here, they're resilient. They prepare for hurricanes here every year. This is their thing. They can handle hurricanes, but they also can prepare for the staffing needs, and they don't show it. So they don't show the stress. So then the patients don't even know that they're short 2 NAs. They don't know, and the patients should never know. They should
That's
never
right.
worry about staffing.
Mhm.
They should always know that they're going to have Select will provide them with the care that they need when they come to the hospital. That's just their expectation, and they shouldn't have to worry about it.
Mhm.
I
I
love
love
that.
that. So what I heard you say, you really are empowering people to come up with a solution.
Exactly. And
Mhm.
I'll support them. I'm not here. I'm not here 24 hours a day. So if they can tell me, Lisa, I'm a little above our staffing for nursing grid because of this, I will say, bravo. Bravo that you took care of the patients in front of you and let me explain the financial side of it to my leader. And I've always been supported. Now, it's not something that they want us to do every single day over staff nursing, But if it was the other way around and I was short nurses and I could bring in CNAs, they would let me do that too. So as long as you can explain the why behind what you're doing, and the team, right? The best leaders, surround yourself with people smarter than you. And I have some amazing leaders that are very bright in what they do. And so I've always been supported, and that's why I'll always stay with this company.
I love
But
that.
I think it's not only just surrounding yourself with great people, it's giving them the autonomy that they need to be able to do their job, the trust in the system, the trust that they will make the right decisions that are going to reflect positively on patient care outcomes, nurse staff ratios, patient safety, nurse safety, creating an environment in which people want to work.
Right.
Agreed.
Yeah, well said. So Sharon, I'm going to toss this back to you as we want to close here. If you have any extra questions from Lisa or any sort of comments, of course, you've been in that space forever. So give us your thoughts, Sharon.
Lisa, you shared a really interesting background in terms of how you got to where you are now. I was intrigued by it. I'm one who has lived in probably 7 or 8 states and a couple of different places and has practiced all over, even out of the country. So I totally have tremendous respect for somebody staying in the same area, in the same region, or within a few hundred or 1,000 miles of one or another, but being in that space, in that same licensure area, if you will. Forget about the fact that we're moving toward totally compact, because I have a lot of licenses. And I finally gotten to the point where I really only want one compact license, and that would be great. My question to you would really reflect on that whole concept of what advice would you give upcoming young rising stars like yourself who aspire to be nurse managers, who aspire to be in leadership, but are perhaps torn between the concept of, I love being at the bedside, I want to give direct patient care, and yet sometimes, as you well know, we promote people to a management role when they don't want to be the manager. They want to manage patient care. So what advice would you give to the next generation of rising stars, those who are going to be here, and Dina and I talked about this morning as well, to take care of all of us?
That's right. That's right. Well, again, Select has this right. I'm in scrubs, right? I'm a CNO with scrubs on. All their CNOs wear scrubs. Different organizations look at that differently. They want their CNOs in business attire but I do everything that I ask my frontline coworkers to do. So I intentionally bathe patients. I intentionally took a patient to a shower last week that had never been in a shower because he's on a ventilator. So I intentionally do bedside nursing still. So my team knows I would never ask them to do something I would not do. So you can still be a great leader and do bedside nursing. They go hand in hand, and they should go hand in hand. Do I have to be the best IV starter now since I don't do IVs all the time? No, but I will be there to guide any new nurse that needs to know how to do an IV, because I've done a lot of them, but I don't do it as frequently anymore. But I will, I work night shifts too. I come in and work with my night team. That's very intentional because I want them to know that I am a leader that wants to see what their barriers are. I want to be here for them. So I would suggest any new leader, it's something that you're either going to be tapped on or you're going to feel called to. Don't ever lose the fact that you're a great bedside nurse, because that is very important in leadership.
And it sounds to me from what you said that the LTAC environment is the absolutely right environment for people who are torn in the middle, if you will, who really want to be out there at the bedside giving care, but also want to learn new things that will help them to reach their specific goals in terms of personal and professional growth. So it looks to me as if just the introduction of LTAC to the greater nursing community, something that they're not familiar with and perhaps should be, would be a great, great recruitment mechanism.
I agree 100%.
Kudos to you. Kudos to you.
Thank you.
Well, certainly we want to ask anybody, we know we have a few people on with us. So is there a question for Lisa? If you want to mind to put that in the chat, I'll be able to ask that question for you. And I'm so glad that you joined us today, Lisa. I know you're really busy. I know you're crazy busy, but I want to say thank you for joining us today, because I think it is a very powerful and needed service for healthcare, this LTAC, and how many people really just don't really understand what an amazing service this is. It truly
You've
is.
introduced an entirely new model
Well,
that I
thank
would
you so
bet you
much.
50% of nurses have never even heard of.
Yeah. So
Well, thank you so much for having me, and I love to talk about Select and what we do. So thank you so much for the platform.
Thanks so much.
thanks for joining us today, Lisa Hallam. We just wish you the best in all your endeavors. And Sharon, thank you, obviously, for co-hosting this with me. We're going to end the broadcast today, and we wish you all well. So thank you for joining us.
All right.
Thanks.
Bye-bye.